Hi, everyone. Thank you so much to our webinar, Open Streets, What Happened, What Did We Learn, and What's Next for People First Places. I'm Kelsey Card, Communications Manager at America Walks, and I'm joined here today by Jose Leal, a landscape architect with MIG and director of MIG's Tribal Nation Building Studio, and an America Walks encompassed everything from complete streets to parks, and he leads a collective whose work focus is to strengthen tribal community cohesiveness and resilience, self-determination, and sovereignty. Jose will be your host and moderator today, and I will be running the technical details behind the scenes. So before we get started, I just want to thank our sponsors today, including the Centers for Disease Control and Prevention, for making these great events possible for us here at America Walks. And to all of you who even have to make sure who attend our webinars regularly and donated to make sure our webinar program and other programs continue to thrive, thank you. These programs allow us to directly support local grassroots activism and education, along with making an impact on issues. And please consider making a donation towards our webinars and this important work. And just a quick note here about the technology. So you should see a control panel just like this on your screen. That's where we'll be on the lookout for your questions for our panelists today. So after presentation, we'll kick off a Q&A session. So please enter any questions that come to mind during the presentation right there. And if you'd like to use our closed captioning today, the link is in the chat box for you. So we have 4 wonderful presenters today who have all been working on or within this issue for the last year. Dr. Tabitha Combs is a researcher and lecturer in the Department of City and Regional Planning at the University of North Carolina. She conducts research on road safety, travel behavior, and mobility, on understanding the social and environmental aspects of transport and land use policies. Tab has been at the forefront of research and trends around the open and slow streets movement in the last year. And Matt Ainsley is the market strategist for EcoCounter in Montreal. EcoCounter revolving organizations have the tools and resources necessary to collect and communicate robust, accurate, and powerful bike and pedestrian count data. So Matt manages EcoCounter's partnerships with leading advocacy organizations across North America. And since the start of the pandemic, Matt has been tracking the growth of cycling across 13 countries on EcoCounter's interactive data dashboard. So leveraging that data to keep the momentum going into the future. And Warren Logan serves as a policy director of mobility and intra-agency relations office of Oakland, Public Works Department, and other Bay Area public agencies to develop strategies that advance the city's vision for safe and sustainable transportation for everyone. Warren and his team have been instrumental force behind Oakland's noteworthy 74-mile Open Streets project and the Essential Places initiative. And Clara Cantor is the community organizer with Seattle's leading grassroots walk bike advocacy organization. Clara leads a coalition of neighborhood-based volunteer groups working to make every neighborhood in Seattle a great place to walk, bike, and live. They were instrumental in pushing for open streets in Seattle called Stay Healthy Streets and Keep Moving Streets, and cannot reach to determine if these temporary pilots were actually working for people. So today's webinar focuses on, the scope of the Open Streets response, the effects on active living and mobility, and the challenges with implementation and community engagement. So what lessons did we learn as the Open Streets movement sort of transitions now into a post-pandemic world? That's what we'll talk about today. So thank you so much for being here. I'm going to turn things over to Tabitha now. She'll get us started with a high-level overview of the Open Streets response. Tab, I'll let you take it away.
Thanks, Kelsey. And everybody, I apologize if my audio goes bad. My neighbor just started a leaf blower about 30 seconds ago. So pretty excellent timing. Anyway, I'm going to kick us off today. I'm briefly reviewing the ways that cities responded to changing mobility demands that were brought on by the COVID-19 pandemic. And then I'm going to dig into what I believe are some of the biggest keys to understanding how and why cities acted. And this is a really critical thing to understand as cities start to debate whether or not to keep these actions in place. And I'm going to finish up by explaining the sort of research that mobility researchers, professionals, and advocates can do to help ensure that the lessons we take from 2020, the good and the bad, will help us build new best practices for enabling and encouraging active, equitable, and sustainable mobility in the future. So the pandemic ushered in a dramatic shift in how cities think about and allocate space for people who walk, roll, and bike. Creating space for non-car modes normally takes years, if not decades, and sometimes never even gets done. Yet during the early months of the pandemic, cities seemed to be able to create these spaces pretty much overnight. So something really big shifted in the way city leaders thought about and valued space for public uses. The first clues this shift was coming were back in March of 2020. That's when I first learned about Philadelphia's decision to start their summer open streets program early in order to create COVID safe recreational space. And I thought, hey, other cities gonna do this too? So I looked at social media to find some examples. Fast forward 13 months, with support from the PedBike Information Center and from Carlos Pardo of the New Urban Mobility Alliance, we've now got a data set of over 1,300 such actions in more than 500 locations around the world. And 844 of those actions to date involve explicit reallocations of public road space away from personal motor vehicles and toward walking, biking, and outdoor commerce. In most places, it seems there's really no playbook for adapting transportation networks for a pandemic, so city leaders had to get creative. In the interest of time, I'm not going to get into all the different kinds of responses we've seen right now, but I'm happy to revisit that at any point during the Q&A or in the future. For now, I want to focus on what these responses and the processes behind them mean for the future. The pandemic prompted a wave of new approaches to accommodating walking and biking all around the world. And these approaches all had one thing in common. They happened fast. The traditional barriers to implementing walking and biking facilities, that there's not enough space, not enough money, not enough analysis, or not enough support, they seemingly vanished overnight. And this vanishing act raises two very big questions. Why did they disappear? And will they stay disappeared? From what I've seen in the data, there are three keys to understanding these questions, and thus to figuring out what our big takeaways should be from the COVID streets phenomenon. Recognize the forces driving cities' mobility responses to the pandemic. Explore differences in the response speed and scale of cities' actions, and really dig deep into the role of planning and public engagement in motivating and shaping cities' responses. Let's start with the first key, understanding the motivations behind cities' various responses by looking at the evolution of responses over time. So early on, back in March of 2020, cities were focused on minimizing virus transmission by creating takeout zones for restaurants. This falls under the other commercial support, which is the dashed purple line on this graph, and automating walk signals, the dashed blue line. Then in April, we see a huge interest in creating street space for walking and biking. That's the solid blue line. In the beginning, this came almost entirely in the form of open streets in cities that already had a history of open streets events. As that line gets steeper, that's when we see a lot more cities coming on and putting in pop-up bike lanes as cities look to create mobility corridors to make up for drastic drops in transit ridership. We also see a lot of soft closures of neighborhood streets, partly to help connect those mobility corridors, but also in response to recognition that kids are going to be out of school for a real long time and they need safe places to play. And then once summer rolls around, we see a growing interest in carving out street space for commerce. That's the solid purple line. And the cities were responding to calls from restaurants and stores that were desperate for safe ways to stay open during the pandemic. So what we're seeing here is an evolution from a public health response to reducing the risk of disease transmission to reacting to changing mobility demands, to keeping businesses afloat. Predicting which kinds of these responses might stick around is going to depend in large part on what motivated them and whether those motivations are likely to stick around. The next key is when cities began their response. Here we're seeing the start dates for US cities' changes to the allocation of street space. The main point here is that some cities were able to move quickly and comprehensively, while others had substantially lower and more limited responses. Part of understanding what happens next depends on understanding these differences in response speed and scale. Was it differences in active mobility cultures, differences in state level politics, in resources or institutional frameworks, or was it something else entirely? And finally, in order to understand which responses, and more importantly, which processes that led to those responses should stick around, we need to figure out where and from whom the ideas came. I mean, if we want to know what the best practices ought to be, we need to know how cities determined whether, how, when, and where to act, and who got to be involved in that decision process. Because at the same time, many of us were rejoicing that cities were finally willing to make dramatic changes to how people move around. Others were pointing out that this process, this dramatic overnight change to street space, many of which required police involvement to implement and to maintain, was just another manifestation of entrenched systemic racism embedded in transportation planning in the US anyway. And the data may bear this out. The vast majority of the actions we saw popping up were unlinked from public input processes. Up to 92% of them were entirely new, explicitly in response to COVID. So they weren't part of any pre-existing plans. And in most cases, they weren't even linked to ongoing community discussions about mobility. I mean, there are exceptions, but wow, I mean, that's a lot of top-down planning that affects huge amounts of public space. And that's problematic, especially with respect to conversations about making these specific actions permanent. But at the same time, there are some tangible benefits that have emerged from this COVID streets phenomenon. The biggest one, in my opinion, is how cities have managed to dismantle many of the formerly intractable barriers to ped bike projects. So things like lack of money, lack of precedent, or battle-tested safety standards for different interventions. So the big challenge here, the big question is how to advance such projects, but do it through an inclusive process, creating structures and facilities that work and ensuring costs and benefits are equitably distributed. There's a ton of research ahead of us to figure this out, and it's more important than ever because the way we've traditionally accommodated walking and biking, we know, is unsustainable and unjust. So these are the next steps as I see them to develop the knowledge base that'll help us figure out what bright spots might emerge from this awful year. I want to keep documenting what happened, why, and to what effect. We're working with some of our research partners to create a structured case study guide that'll help enrich our database and deepen our understanding of cities' responses. These case studies will help us compare differences in how cities rolled out their interventions, what enabled some cities to respond quickly and adapt on the fly, while others seemingly took eons to make their first move. And we need to interrogate the role of planning and public engagement in informing these responses. Lots of cities have robust mobility plans. Why weren't they used to guide cities' actions? And does the apparent newfound tolerance for experimentation with temporary materials allow for more meaningful public engagement practices? And should we keep experimenting with temporary materials in the future after the urgency of the pandemic has subsided? We lay out these questions in our research agenda. You can see it in a paper we published this winter at the link on the screen. But I'm also really curious to hear what you all think, both the guests and the panelists. What questions do you want to see tackled as we look to build new best or maybe just better practices for creating safe, equitable space for walking and biking? So thanks for listening. Happy to take questions and bad ideas around with you during the Q&A or afterward via email and social media. All right, and with that, I'm going to hand it over to Matt.
Thank you very much, Tabitha. Are you able to see my screen? You're able to see my PowerPoint?
Everything looks great. We just need that full screen view.
Perfect. Thank you very much. Okay, hi everybody. It's great to be here today. Thanks for getting us started, Tabitha, and to America Walks for the introduction to this panel today. I'm really thrilled to be here and talking about what I think is a really important subject. And I think we're having this conversation at just the right time, really, as that light at the end of the tunnel gets a bit brighter for all of us. So my name is Matt. I work as a market strategist for EcoCounter. And for those of you who are unfamiliar with EcoCounter, we design and manufacture bike and pedestrian counters, and also work with leading organizations across North America and Europe to enable a data-driven approach to bike and pedestrian planning and to support advocacy efforts. So during the presentation, I'm going to give you a quick rapid-fire introduction to 2 examples of how data collection was used and leveraged to support safe and open streets initiatives. So a full-on rapid-fire approach, and with that, let's jump in and let's go to Montreal. So the first example, I want to talk about Montreal. That's where we're based, and in some ways we use it as a bit of our testing ground, essentially. At the beginning, very early in the pandemic, right at the beginning, Montreal deployed the VAST, the Voies Actives Sécuritaires, which roughly translates to health corridors, security corridors. And at first that was, Tabitha talked about that, the progress of how things were implemented, and Montreal really fit under that too, in terms of, at first it was just sidewalk enlarging around essential businesses with lineups like pharmacies and like grocery stores, but that quickly turned into a full-on plan for the summer, which included 100 kilometers, 62 miles of pop-up active mobility infrastructure. That was primarily on-street cycling infrastructure, but also involved quite a large number of open streets projects for principal commercial streets. That is shutting down the streets to vehicle traffic and allowing businesses to expand a patio on the street, giving people a way to safely support their favorite spots in town, and creating those essential spaces that we all needed during 2020. The city already had a pretty significant permanent count program, both bikes and pedestrians, but they supplemented that program with 33 temporary counters. So let's go first to Wellington Street. It's the photo that's, it's the street that's photoed here, and it's your classic commercial street with bars have patios on the street, parking lane was removed, vehicle traffic was removed, and people had access to those businesses during this time. So Wellington Street has had a permanent headcount program in place for a couple of years now, and in 2018 and 2019, it was just a regular commercial street with sidewalk, on-street parking, and a vehicle lane. No open streets project, besides a couple of days a year, a couple of days in the summer a year, where these weekend open street events drew significant volumes. I don't think I need to really show you on the daily headcount graph which days those were, but like a food festival or a street sale, things like that, drew in huge pedestrian count volumes, double, triple, quadruple the amount of pedestrians usually seen during that time. Even before the pandemic on that street, we knew that when you open that street, more people tended to come. They become more attractive places. So then during the pandemic, when that street was fully shut down and became an open street, we really saw a nice long-term impact of that change. And we saw on a consistent basis that the daily average pedestrian counts were about 30% higher, something instead of like 5,700 peds counted per day, up to something like 7,500 pedestrians counted per day for the whole summer. What that tells us is that build it and they will come, because people tend to stay when we create those attractive places. People like those spaces. So this to me is really like the power of data here, in that it allows us to see the things that we all experience on a day-to-day basis. We know that people are out using the bike lanes. We know that people are using the shared spaces, but having that data in hand allows us to justify those projects and communicate the successes, and most importantly, improve them and make them better. How about when we take those projects away? Cutting across town a little bit, we can compare 2 other commercial streets, Mount Royal Street and Villeray Street, and same kind of setup. Commercial streets that were pedestrianized for the summer opened up in the exact same way as Wellington Street. But Mount Royal Street, the end of their program, it's in a different neighborhood, a different jurisdiction, so their program ended at the end of September. Villeray Street, in a different neighborhood, different jurisdiction, kept their open streets program throughout the fall. And if we compare the same weeks, we see a 30% decrease in pedestrian counts on Mount Royal Street. Villeray Street, at the same time, experiencing the same weather, experiencing the same COVID restrictions, experiencing the same cycles, kept that same volume. When we remove those open streets, the volumes decrease. So are they good for business? This is a really important question, and it's one that we could really dedicate the whole webinar to, but I think given that we're talking about commercial streets, it's important to at least touch on it. I've included the links at the bottom to these 3 studies because I won't quite do it justice in 30 seconds, but it's certainly worth exploring. We're getting to a point now that we have enough data to be able to look at the economic impact of these projects, and so there's certainly more to come. A study came out recently by Yelp that looked at consumer interest at eateries in car-free areas at 5 US cities, Boston, San Francisco, Chicago, Boise, and Burbank, and found that consumer interest in eateries in car-free areas was significantly higher than consumer interest in eateries at non-car-free areas in the same city and in the same area. And that was true in San Francisco and Valencia Street, 18% more consumer interest on car-free days compared to the start of the pandemic. In San Francisco, the Office of Economic Analysis recently released a report that looked at the economic impact of parklets for business. So a parklet where you replace a parking space with a patio. They looked at 2010 to 2019, so that is pre-pandemic, but a nice consistent period, and found that for businesses who installed the parklet, their average quarterly revenues grew by 29% in the year following the parklet application. And lastly, a real throwback to 2012, we've known for a while that cyclists and pedestrians tend to outspend vehicle drivers on a monthly basis. A study out of Oregon showed that bikes and pedestrians tend to spend less on a per visit basis, but visit local businesses more frequently and therefore have higher consumer spending on a monthly basis. So let's switch gears now a little bit and let's turn to Denver. And it's a really different example because switching away from like those pedestrianized commercial streets to an example of like an open streets and a safe streets project on neighborhood and residential streets. And I want to talk to you a little bit about Denver Streets Partnerships, a nonprofit advocacy organization that's working hard for safer, more equitable, and more vibrant streets in Denver. So this is a really different example because it's not commercial streets, but it's also, Montreal has the benefit of having a giant count program, a giant data collection program in place already. That's not so true in Denver. And Denver Streets Partnerships are a small advocacy organization with a little amount of resources, but it's quite impressive what they've been able to do. Right at the start of the pandemic, beginning of April, Denver launched 5 miles of access-only shared streets and 10 miles of open streets. And it's thanks to DSP, Denver Streets Partnerships, that those happened because in March, they circulated a survey and found that 90% of respondents wanted more space for walking and biking. Took that to the mayor, and the mayor said, okay, let's run with this, let's do it. They had access to 1 counter at the beginning of April and deployed it for 11 days on one of these new shared streets. And compared it to the only other time they've had access to the counter when they borrowed one from Colorado DOT back in 2015. And again, same thing, build it and they come. We see the street was used at equally or more to 3 times the amount of people using those streets than the 2015 average, that baseline period, excuse me. So what I think is most interesting is about how they're able to do a lot with a little and deploy a whole toolbox of data collection efforts. In speaking to one of the members of staff, they describe their efforts as they use a quote, whole package of qualitative and quantitative data to say to the city, let's keep these things and let's make them better. And for me, this is really, really powerful, like harnessing that toolbox of data collection efforts, whatever they can get their hands on. For example, in looking at spin scooter share data, they found that scooter ridership was significantly up on shared streets compared to adjacent streets without treatments, including up 329% right at the beginning on 16th Street that had a treatment. Surveys with the local community were an essential part of the story and were done multiple times. Well into the program last summer, their survey found that 86% of respondents wanted shared streets to stay after the pandemic. And of those 86%, 2/3 of the people lived on a shared street or lived on a nearby one, really engaging the local community. And they also do that with interesting and creative quick wins and low resource wins too, including asking local residents and getting volunteers from the local community to just enter in traffic safety data, such as speed data, with a low resource radar gun. And that's a quick win. That's an easy way to engage the community. Even if you're not someone like many people in the audience who really care about these issues, most people are going to be pretty okay and pretty excited about living on a safer street where your kids can go and play outside with a lower speed limit on your street. All of these efforts were done together to support a temporary to permanent approach. That is, taking what we learned and trying to make it permanent through engaging the Business Improvement District or engaging the local DOT. And they did so successfully. Took all of this data to the city in a report in November. Here's what we found. Here's why people like it. And it's working. 2 of those shared streets have become permanent. Some of the temporary installations have been transferred and upgraded to permanent installations. So lastly, how can we make data count? What did we learn from the pandemic with regards to data collection? A lot, and we're still learning, but we know that a little bit of data can go a really long way. Sure, it's great, a city like Montreal and others in North America that have giant count programs, but we've learned that with a little bit of community surveys, that toolbox, right? The community surveys, manual counts, screen line counts, tapping into public open data, tapping into crash data, those things can go a long way, especially when we're able to communicate that data and leverage that data. Denver Street Partnerships also do a great job of getting it in the media and just talking about that data, like being quoted about it, making people aware of the projects and making people aware of the benefits of the project. They do a really good job of leveraging a little bit of data. Because data can be low resource interventions for data also. So much of pop-ups we talk about how it's a low resource, cheap intervention, bollards, planters, but that's true for data also. A volunteer manual count is a low resource data intervention. There's also the last adage, which is, if you don't count, it doesn't count. Data collection is really, really important to support safe and open streets projects. And with that, I will pass it off to Warren to hear a little bit about what happened in Oakland. Thanks everyone for listening today. And I'd like to give a special thanks also to Jessica Vargas, who is the program manager at Denver Streets Partnership, who very generously gave her time to share the hard work that they're doing. Thanks, Jessica.
Matt, I think screen. Hey everybody, good morning and good afternoon. I'm really excited to be presenting what the City of Oakland did for the last over a year now. And it's been really exciting to see how many other cities, and really kudos to you, Matt, for sort of drawing out what several other cities did over this last same time. So I'm excited to kind of share with you both specifically how our Slow Streets and Essential Places program operated and continues to operate. And then I'll finish up with kind of where I think we're all headed in the City of Oakland. So for many of you, if you were watching the news back in April of 2020, which I cannot believe it's been over a year now, you might remember this map. The City of Oakland announced at the time that we had planned on closing 70 plus miles of the city's neighborhood bikeways to through traffic, again, sort of access only, to use Matt's words, as part of a response to the pandemic and recognizing how many folks were congregating at our Lake Merritt specifically, which I don't know if you can see my cursor, Lake Merritt is right here. And so we wanted to respond really quickly. For a lot of the slow streets that many of you probably know well about already, this is what they saw, just beautiful families strolling around and enjoying the sunshine in California, right? That this was a scene for about half of the city. Unfortunately, one of the things that we learned early on as well is that the other half of the city, and I'm sort of waving my hands wildly of sort of North Oakland versus East Oakland, that was not the experience that people were having. And there were a number of reasons for that. One was that I think a lot of neighborhoods felt we hadn't conveyed the purpose of the program very well, and this is a challenge that I'm hoping we talk about in our question and answer period. I think a lot of people in a number of our East Oakland neighborhoods felt that traffic safety programs, and this program specifically, was a tool for gentrification and ultimately displacement. And I'll say sort of bluntly that that represents a much deeper trauma and struggle that I think many of us in many cities face when we talk about implementing safety programs throughout the city. So you'll find as I go through my presentation, there's sort of marks where I want to document lessons learned. So here's one of them. Overwhelmingly, community engagement is key. And so we started hosting a number of workshops every single week with neighborhood stakeholders and modal stakeholders like Bike East Bay, Walk Oakland, Bike Oakland, you name it, to talk about what we could improve week after week on the Slow Streets program. And again, just to the sort of important factor, we as a department and really as a city are consistently trying to understand how to meet people where they are. And I don't mean that just physically, I mean that like emotionally and mentally as well. There's a lot of trauma that people have experienced and a lot of hardship that often shows its face in places and spaces that we don't expect. And Slow Streets is certainly one of them. So in response to a lot of our community engagement, many folks said that it would be helpful if we could help people connect to their essential places. So in fact, the program is aptly named Essential Places. Here's one of them, connecting folks to a cleaner in the neighborhood that also serves as sort of a community meeting spot as well. We now have 20 essential places throughout the city that have since been upgraded from orange traffic cones, since we ran out of them about halfway through the summer, to soft tip posts and now the hard bollards as well. Again, a lesson learned here, and this is based on the community engagement, is being flexible, finding ways to iterate on the programs that you see and not just sticking to kind of the vision and saying, this is what we have to do. One of the things that I'm especially proud of our team for doing is that week after week, something changed about our program, right? The first couple of weeks of Slow Streets, we had, the close to through traffic signs. Then we added, posters that a number of our advocates had created with artwork that really helped convey the message correctly. In the case of the essential places, again, we had gone from the cones to the different signage to a series of different designs as well. You see here that we've actually pinched the crosswalk so that people have to merge to the outer lane, forcing them to really consider who's walking and giving a lot of people space to see those pedestrians. Another iteration here, and this was announced last fall, is that we had received a grant from Smart Growth America through the National Endowment of the Arts program to completely rethink what a Slow Street might look like with, again, some community-driven artwork. And so you see here the mayor announcing our efforts to finalize this program. And again, a lesson learned here is that cultural competence really matters. And I just want to highlight something, and you can see my cursor here, about these two girls running in the street, and to compare that to the pedestrian sign that we all know and love from MUTCD. There's something about these two girls that I think people in our communities really responded to. And in fact, several people said that they could see themselves in these people running. In the same way that this bicycle symbol is actually the logo from our Deep East Oakland bike club called the Scraper Bike Team, that helps youth learn how to repair bikes and in fact ride safely throughout the city. Using these types of iconography is really critical to showing people that we're talking about them. We're not just talking about everybody under the sun. We specifically mean to help you and your neighborhood feel safe. The final lesson here, and you'll probably hear me say this a lot during our panel discussion as well, is that one of my major goals throughout this engagement process was to consistently ask the question, why, right? If someone said, I don't like the Slow Streets, I'd ask why. And they'd say, well, they're messy. And I'd say, why? And finally, after about 5 or 10 of them, we finally got to some really important lessons that I don't think we would have understood had we not gone through this pilot process, which is that some of our streets exhibit so much dangerous behavior that signs and barricades are nowhere near the level of safety infrastructure that people want and feel that they need and frankly deserve to make them feel safe. And that's an important lesson learned that Slow Streets has brought us to, where, and I think looking back now a year from today, there are some slow streets that I would say are not working, but that the lesson from that is we need to rethink what traffic safety looks like on some of our streets and go even deeper. I want to zoom out for a second, because even though I've just talked about slow streets in essential places, this is just one of several programs that we launched during the pandemic. And this is kind of important to consider, that we are not just looking at how one individual pilot is growing and learning from itself, but that how it influences the rest of these other programs. So you see here, we had a mural program called Paint the Town. You see Slow Streets in Essential Places, which I'm just talking about. Our Flex Streets program in cultural markets was the equivalent of this, but for business districts. And many of you are probably familiar with parklets and sidewalks. So it's been really exciting to watch how all of these different pieces are growing towards what I would hope, and it's funny, we're having this active conversation this week about how all of these different planes land safely back into our municipal code, frankly. What underpins this effort, though, and this is the sort of soft focus that I want to share with all of you, is that it's really critical to partner with the community. And more importantly, to provide opportunities to train new leaders to partner with you. We're also finding that templates are fantastic, and that it helps our team not rubber stamp, but it helps us move faster throughout many of these different types of implementations. Again, and this is probably true for many of you, by bringing together not just the DOT, but the fire department, the police department, community advocates, and working across the silos, we were able to move much faster and, in fact, take calculated risks in a way that I think we're really successful. And then finally, this is perhaps the most important, finding ways for the community to own the programs, and sometimes even the infrastructure itself, is paramount. And so with that, I want to thank you all for giving me this opportunity, and I will pass it off to Clara.
Hi, everyone. Can you hear me?
We can.
Perfect. So my name is Clara Cantor. I'm a community organizer with Seattle Neighborhood Greenways, and I'm here to speak from a community perspective from an on-the-ground advocate in Seattle, Washington. So I'm just going to do a quick overview of who we are as an organization, and then talk about what happened in Seattle, how our open streets rolled out here, some pros and cons, and looking forward, I'm going to talk about where we go from here, and hopefully have some lessons that you all can take back to your cities as well. So Seattle Neighborhood Greenways is a coalition of 15 neighborhood groups that are all volunteer-led and run, and encompasses thousands of volunteer advocates and organizers, interested neighbors, and we have a staff of 5 that work on a citywide level. And I say all that because that grassroots model really gives us a hyper-local, very specific neighborhood insight on specific routes or intersections, and neighborhood culture and community. And so when we work closely with the Department of Transportation here, which is SDOT, we're often advising on routes or designs, or conducting community outreach and engagement, as well as pushing for more and better accessibility and safety for folks who are walking and rolling and biking and accessing transit and all that. So the Open Streets program here in Seattle, Seattle was the first city in the US that was hit by COVID, and we were one of the first cities that was thinking about responses because of that. So Seattle Neighborhood Greenways was pushing for the idea of open streets, and our vision was to have open streets everywhere, in every neighborhood, accessible to everyone, but particularly concentrated in dense neighborhoods of Seattle with a lot of apartments and people who didn't have access to private outdoor spaces. As we were all on lockdown, that was really, really crucial for folks who were living in tiny spaces without access to the outdoors. The city picked up the program in April, and launched a few miles at a time steadily throughout the spring until we had 25 miles of open streets in 13 different locations around the city. And at that point, we were getting national attention for this program. It was really exciting. And it has grown and expanded since then, but I'll get into that a little bit later. So one of the ways that we launched so quickly that I think differentiated us from a lot of other cities around the country is that we use an existing network of neighborhood greenways or bike boulevards in other cities. So with a couple of exceptions, all of the open streets that were under the Stay Healthy Street branding in Seattle were basically upgrades to existing routes, which had already gone through a public engagement process. So I don't know if you can see my cursor, but you can see here the painted signs. There's stop signs on all the cross streets, and there's speed humps there. And the Stay Healthy Streets added these street closed signs in the cone. The street closed sign is a little bit misleading. We have a state law in Washington that prohibits walking in the street unless there's no sidewalks or other walking spaces available. And so in order to make it legal to walk in the street, our DOT had to use the street closed signs instead of something that might have been more accurate, like no through traffic or local access only. And that ended up creating a lot of confusion for a lot of people, particularly residents and delivery drivers and folks who were trying to drive on those streets. That was one of the first lessons learned. The city eventually started putting up these blue streets that clarified the purposes. And that was helpful. Later, we upgraded to these larger type Class 3 barricades where the streets were crossing arterials and they were seeing a lot of people ignoring those A-frame signs. So it was a super fast, super basic, easy rollout without a lot of engagement with the neighborhoods. So as an organization, we wanted to see how people were using the streets and whether they were really working for residents. So Seattle Neighborhood Greenways actually launched a major outreach effort, and we had volunteers hanging door hangers on every home and business, posting flyers, talking to people in the streets, and ended up getting about 9,000 survey respondents for the city's survey, which is pretty huge for Seattle and ended up being really crucial information for us going forward. The results were overwhelmingly positive, but there was a lot of confusion about the program, similar to what Warren was saying in Oakland. So I'm going to start with some of the pros and then talk about some of the complaints and how those were improved upon. So when I say that this was overwhelmingly positive, one of the First Avenue Stay Healthy Street up in Greenwood neighborhood had over 80% support for making it permanent, which is absolutely incredible given that any changes to streets tend to be really controversial. We saw all over the city communities really taking ownership of the streets in a way that we hadn't seen a lot of before. You know, paintings popping up, decorations in public art, murals, people left sidewalk chalk out, and people coming by would write responses to a question, or neighborhood art galleries with clothespins where you would leave an artwork, take an artwork kind of a thing. This image here with the roller skaters is out on Alki Point. Neighbors held a weekly chalk art party where they would come and decorate the street. And it was really amazing seeing that level of community ownership of these street spaces in a way that we hadn't really seen before when these were existing neighborhood greenways. So we saw in the complaints, again, similarly to Oakland, a large portion of those were complaints about, you know, support for the concept, but complaints about the signage themselves and the infrastructure, how they were so temporary and cheap, how they kept getting moved or hit by vehicles and destroyed. We had signs that were hit and broken, and then it would leave debris in the street. This one here is in this planting strip, but we had a lot of signage that was moved to the sidewalk, and then it would fall over and be blocking the sidewalk. Some of that was alleviated when SDOT started rolling out the new signage, but some of it definitely remains. And similarly to in Oakland, especially in communities of color that had already held a lot of distrust in the city and had a lot of community trauma, the cheap signs were kind of insulting. Like, all of these great city intentions become another pile of debris cluttering up the street that no one's coming to clean up or fix. And a lot of that, similarly to what Warren was saying, comes down to really understanding the community that you're working in. And, you know, sometimes pilots are really great because it helps people actually see and experience a street in a different way than they have before. But in many communities, cheap pilot programs like this are seen as kind of a waste of money because there's no trust that it's ever going to be something more or better. And I think that particularly in a lot of communities of color, they see their cities and institutions doing a lot of these really bright, shiny programs in their neighborhoods over the years with no community grounding, no outreach, and then they're abandoned because they didn't work, and this program fell right into that narrative. So I'm not saying that pilots are terrible or we need to start over from scratch, but we really need to acknowledge what's happened in the past and ask people what they want. And if this isn't what's working, we need to find alternative ways to meet those community needs. So in Seattle, through our outreach, we're hearing people using the Stay Healthy Streets in 4 main ways. For recreation, for transportation, for community gathering and play space, and then as traffic calming. And each of those 4 uses kind of comes with a different set of needs. And so we really need to be paying attention to what those community needs are and making sure that we're talking to communities about how we're making those decisions and how those needs are informing what's going forward. We also had a lot of complaints from vehicle drivers, and I think the important thing there was keeping closures consistent and putting signage up for drivers well in advance to give them the choice to take alternative routes. One of the other main sources of confusion in Seattle was that we had these 5 different pandemic response open streets programs that all looked very similar from the street, but had different rules and announcements and feedback surveys. And every time that there was a new announcement from the mayor or the city, there was kind of a new wave of confusion about whether that announcement applied to the open street in my neighborhood and what that means for me. And there was, you know, a lot of trust eroded there, and a lot of people started just ignoring rules and announcements and doing their own thing. So as you're moving forward, I think it's really important for a lot of cities that have these type of programs to think about the branding that they're using and paying really close attention to how it's overlapping and interacting with other programs or labels to make sure that that's as clear and easy as possible. I think we also need to think about how we're defining success or failure of these streets. You know, as we heard earlier, that can really make a huge difference. Are we measuring how many people are biking past in an hour? Are we measuring whether or not kids feel safe in the middle of the street? Are we measuring how it affects neighborhood vehicle traffic patterns? Because all of those questions will give us really different answers about the success of the street. I'm going to kind of skip a little bit forward here. So, you know, I think that whatever your city has in place temporarily, open streets really need to be responsive to the needs of the community. And I mean that really hyper-locally. Cities should be thinking about really easy, really accessible ways for people to be using these streets for whatever they want to use them for, and really make them their own. We saw a lot of really successful partnerships with other programs and with community groups to host festival streets, farmers markets, neighborhood block parties, other gatherings, and really be thinking about ways that we can turn these street spaces into the community places that we've all envisioned. This is a tweet from our chief traffic engineer about one of these community streets. And now I'm going to turn it over to Jose, and we're going to jump into our panel discussion. Thank you so much.
Yes, thank you. Great presentations. I just once again want to thank all of you for really sharing and highlighting some of those benefits and challenges that were experienced during the COVID era. My main takeaway, honestly, is one of hope. I feel like there's been a lot of data presented today, and I feel like there's a lot of more communities who are interested in the open streets that can maybe help us create some motivation to really push the open streets beyond this pandemic era. I know there's a couple questions here and we're running short on time, so I'm going to skip my questions and kind of jump to some that I'm seeing on the screen here. So bear with me as I navigate to my chat box. Let's see. Okay, so one question that came in was, what are we doing to make women safer from assault while walking? Safety from cars and safety from assault are both essential. Do any of the panelists have any experience in that topic as it relates to the research or knowledge you have?
I can jump in on that one. We've been thinking a lot about community safety, both in terms of safety from other people and safety from police and whatever that means for communities. And I think that one of the things that's really helped is thinking holistically about a street in terms of both the infrastructure and the people infrastructure that are around that street. So when we're talking about walking routes in particular, when you're thinking about infrastructure, the lighting is really important. The access to other spaces is really important. We have one bike route here in Seattle that is kind of alongside a train track, and it's very enclosed. It's very long and narrow without a lot of exit points, and it feels really unsafe to be on at night because if you were to encounter somebody else, there's not really any place for you to go. And so when we're building places like this, making sure we're thinking about the lighting and the access points, and then what kind of community exists around those spaces at all times of the day and night.
Okay, thank you for that. It's a question maybe for you, Warren, but someone would like to know a bit more about what is meant by community-owned infrastructure in Oakland.
Yeah, that's a great question. I think I mean that in two ways. One is when people feel like they and know that they own part of the process of developing that infrastructure. So in the case of the slow street sign that we came up with at the end, people have said, I feel like I own this sign because I helped draw it, I helped design it, I had input into it. That's one form of ownership. The other part though, and this is something that we're still struggling with, is like, can the city literally give you, I'm waving my hands here wildly, a barricade that you own, and then you just let us know when you're going to put it out there, right? Like that is another form of ownership, in the same way that, for example, parklets are someone's property, right? That, is a whole other issue. But I do mean that in two ways, right? That there's a process ownership and then there's a physical ownership as well. Hopefully that answers your question.
Yeah, thank you. There's another one here that's asking, what was one of the most popular ideas in each of your cities that you can share?
I can jump in here and kick it up to others. And I remind my staff of this all the time, irrespective of if any of these projects are permanent, stay permanent, or where they go after this, a very successful idea was for us to work across silos and actually set down some of our risk concerns. That I think is one of the major reasons why we were as successful as we were.
Second that, we had really successful partnerships with other departments when our Department of Transportation was working with parks and with the school district and with business districts and with the Department of Neighborhoods, it was a lot more successful.
In Montreal, the temporary cycling infrastructure was very, very, very popular at a time in which we saw vehicle miles traveled decrease by about 20%. We saw bike counts and cycling increase by 10, 20, 30, 40% also. They were also kind of strategically placed in more residential areas or connecting particular like greenways and parks and trails in the city. So were very, very well used. That being said, there were some existing cycling infrastructure that saw decreases, in particular around like some of the officey areas and places where people weren't going as frequently because they were working from home a lot. But the temporary cycling infrastructure was very, very popular.
There's one question you're asking. Oh, sorry.
I was just gonna add that I can't speak to individual cities, but generally, looking at the data as a whole, curb space reallocations were by far the most popular sort of intervention that we saw, followed by street closures, whether they were full open streets events or soft closures.
Okay. Yeah, we'll jump in and throw one of my questions in, but for me, I feel the pandemic truly exposed many inequities, and for so many reasons, I feel there's an urgency not to return to normal. So the open, slow, safe, and shared streets aren't really new ideas, but I think the community benefits and a lot of the stuff that we're seeing really magnified the needs for this. I guess, how do we use this momentum and in many ways the disruption to our everyday lives to kind of continue moving forward with these small critical steps in creating a more equitable future for our communities in need?
I mean, I think one way to look at it, go ahead, Tabitha.
Thanks, Warren. So from what I've seen, and I've only seen one of these interventions because it's a pandemic and I haven't gone anywhere. But what strikes me more so than the individual responses is the way that cities dismantled all of the barriers that typically face putting in pedestrian bicycle facilities. There was a much freer spirit. We weren't as hamstrung by all of the engineering standards that are ostensibly there to make people safe, but that the process is really slowed down when you have to follow very particular standards. You have to have very expensive materials, and I think thinking about how many new trips can happen because you made an intervention, you sped it up. How many lives are saved because there is a facility there, even if it's not the one you would have gotten had you waited, had you planned it for 15 years. So to me, the takeaway is, can we take these lessons that we learned about the way we can learn, we can tweak things. It's not the traditional wicked planning problem that there are no takebacks. In this case, there are takebacks. We can truly learn as we go, and maybe get critical projects implemented sooner and save lives and improve mobility much sooner than if we took the traditional path.
Tabitha, I totally agree with you. You took all the words right out of my mouth. I'll add to your point that in addition to our engineers, who I think actually played a fantastic role in pushing others to get out ahead, coming from the mayor's office, another challenge that I see a lot of times is that our lawyers will, and our risk assessment team will say, this could go poorly, don't do it. And instead, during COVID, the mayor and the city administrator said the no build option is actually worse than anything else you're going to come up with, because we have a pandemic to resolve. And that gave people a lot more, and by people I mean my staff especially, the agency to admit when they were saying no to something that they were going to need to let go, right? Similarly, I think government, I'm going to put big brackets around this, does a very good job, a fine job of answering the question that's asked with the goal of saying no, issue one. And two, that we do a poor job of intuiting what the underlying question is. For example, it's like, can I have a permit to put a parklet here? If the answer is no, we just say no. But the more reasonable answer is you can't do it there, but if you move 5 feet that way, yes, right? Like that type of mentality of, as my chief of staff would say, help people, be helpful, is what we gained out of COVID, that people started to really think about like, what are you actually trying to get to? And I want to make this work for you in whatever way we need to, instead of saying, I found a rule that says no, so I guess the answer is no. It's like, but what other hoops could they jump through to get to a yes, right? And that's the type of thinking that I'm hoping that we hold strong to post-COVID. How do we get to yes?
Okay, well, look at my clock here. We're at the hour. I'm going to ask one more question here as a closer. Can you discuss the top 3 best ways to measure success when it comes to open streets?
Yeah, I'll jump in here. And without oversimplifying the issue too much, I think, we're asking the questions, were they used? Were they liked? And who had access to them? I think framing it in those 3 questions, and I think we've touched nicely on those 3 today, and it's certainly a takeaway for me today, like asking those 3 questions, were they used, were they liked, and who had access to them, and really like frames the question of open streets for me, and how we can think of them in terms of temporary installations and pushing for them to become permanent.
Matt, I'm gonna not push back, but give an exact opposite example, which is that success for me looks like, even when the slow streets that I'm thinking of that didn't have any people on them and actually were still just as dangerous, that the calls I was getting were no longer like, don't do anything. It's, if you can move this quickly on something like this, can you use that same energy to try something else? That paradigm shift, I would argue, is more valuable to me as a civic leader than, don't get me wrong, people playing in the streets, which is awesome as well, but that people are finally understanding the full power of their government, and that sometimes they're the ones in the way of that, is really exciting and I think really valuable moving forward.
Okay, thank you. I think we may have time for another question here. I'm scanning my chat. Apologize for the delay. One final question here. How can we transition the legal and political argument of the need to quickly transform our streets to address the public health emergency of the pandemic to that of addressing the public health emergencies of traffic violence, physical health activity, and climate change?
Declare a state of emergency.
Because this is one of the questions that we put forth in our research is, why was the pandemic able to move the needle when all of these other things weren't? And I'm going to shut up because
Tabitha, I'll just pick up where you left off, Tabitha. So I can't remember who said it, and I don't necessarily like the statement, but never let an emergency go to waste, right? Like, your government, I'm speaking for the government, we can do things really well and effectively. We are not set up to, though, and that's on purpose, right? Like, we are the stable organization. In the case of the city of Oakland, and I think this is true for most government agencies, at the start of COVID, we created a whole separate government called the Emergency Operations Center. And it's just the same people with a different hat and a different set of authorities and a different organizational structure. And suddenly, things got done because all of the right people were in a place to move forward on those same issues. And I routinely thought, just as a quick aside, how funny it was that on one email thread, we were like jamming on all this stuff, and the same people on a different email thread for something outside of the organizational structure of the emergency team was like, oh yeah, I can't move this forward. So we routinely would move things into the emergency sections to fast track them. And that to me is like, it's legal because it's a state of emergency, but I think to answer the underlying question, the way you fix this is by reorganizing teams to fulfill like central goals instead of keeping the machine moving forward. This is what a machine looks like, everybody.
All right, well, I think with that, we come to a close here. Once again, just want to reiterate my takeaway, which is really one of hope. A lot of good pieces presented today that kind of helped me build that hope that we have a good future with the open streets concepts coming up post-pandemic. So with that, hand it over to Kelsey to close us out.
Thanks so much, everyone. That was great. We just want to give you a quick reminder on what's to come here. So, and also, if you did enjoy today's discussion, please consider playing a part in keeping more content like this coming your way by making a small donation. We suggest $15 to $20 if it works for you, but anything really helps and goes a long way towards extending and improving our work here. That donation link in the chat box and in the follow-up emails as well. So I want to let you know about our next webinar here. It's Authentic Community Engagement, Best Practices for Equitable Work. This is kind of a dialogue with active transportation professionals, nonprofit leaders, and equitable engagement experts around what it means to practice and build authentic community engagement with diverse coalitions as really the foundation for driving those vital relationships and much more. So this webinar is for Wednesday, July 14th at 2 p.m. Eastern. And again, thank you so much for being here. It's really a pleasure to spend this time with you all. Thanks again to all of our great panelists, some great deep insights here. And just keep a lookout for the survey email so you can tell us what you thought of this webinar. We really do take that feedback and it plays into our programming. So have a great day and we will see you next time.